Good morning. I'm Jeff Berman, United States Attorney for the Southern District of New York. We are in the middle of an opioid epidemic of grave proportions. According to the Department of Health and Human Services, in 2017, over 49,000 people were killed as a result of drug overdose involving opioids. That's 134 Americans dying every day. The increase in opioid-related deaths has actually led to a decrease in average life expectancy in the United States. This opioid epidemic has greatly affected New York City. According to the New York City Department of Health, approximately 1,500 individuals died of drug overdose in New York City alone in 2017, and the majority of those deaths involved opioids. Part of what is driving this opioid epidemic is a prescription epidemic. Certain doctors are selling prescriptions for oxycodone and other addictive painkillers to individuals that the doctors know have no medical need for these drugs. These quote-unquote patients are then filling the prescriptions and selling these drugs on the streets of New York. Doctors who take an oath to care for their patients should be in the first line of defense against opioid abuse, never the cause. Today, we announce charges against 5 doctors and their co-conspirators and 1 pharmacist. These defendants operated in almost every borough: Manhattan, Queens, Staten Island, and the Bronx, as well as Westchester and Long Island. There is no part of this city that is not touched by the opioid epidemic. As alleged in today's charges, instead of caring for their patients, these doctors were drug dealers in white coats. They hid behind their medical licenses to sell addictive, dangerous narcotics. They pumped out massive amounts of medically unnecessary pain pills that were ultimately sold on the streets of New York. And they did it for a very simple reason: greed. They did it for cash, for meals, and expensive gifts. As alleged, one doctor, Dr. Nadim Syed, wrote medically unnecessary prescriptions for oxycodone in exchange for cruises, all-expense-paid trip to Puerto Rico, high-end whiskey, and fancy meals. While these are all separate cases, they have a number of things in common. The doctors did little or no physical examination of their purported patients before prescribing large quantities and high doses of oxycodone, typically 30 milligram tablets, which have a street value of approximately $30 each. Often the doctors did nothing to determine whether their patients were actually using the oxycodone that they prescribed and not abusing other drugs. They did not test the patient's urine or ignored the tests that were done. They did not ask the patients about their supposed pain levels. The doctors often provided refills without seeing their patients again, which violates federal regulations. The doctors typically accepted only cash. The doctors often worked with crew chiefs, that is, someone who recruits purported patients to doctors to obtain and fill oxycodone prescriptions, and after those prescriptions are filled, purchases the pills from these patients and sells them on the street. Now I'd like to go into some details as alleged with respect to the doctors charged in these different cases. Dr. Dante Kabangbang. As charged in the indictment, Dr. Kabangbang operated a purported pain clinic in Queens, New York. From January 2012 up to and including the present, Dr. Kabangbang and his nurse practitioner, who was also charged, prescribed more than 6 million oxycodone pills in exchange of over $5 million in cash. They are the highest prescribers of oxycodone in the entire state, according to Medicare and Medicaid. Dr. Anthony Pietropinto. As charged in the complaint unsealed today, Dr. Pietropinto was practicing psychiatry on Fifth Avenue in Manhattan. He did not specialize in pain management, yet he prescribed oxycodone to approximately 214 patients Over a 5-year period, he wrote prescriptions for over 600,000 oxycodone 30 milligram pills, generally the highest dosage of oxy available. He prescribed one patient over 12,000 oxycodone pills, or approximately 7 tablets per day. He wrote prescriptions to people he knew had no legitimate medical need for it, including to people who had just been released from rehab or were incarcerated. 2 of his patients overdosed on drugs during the period in which Dr. Pietropinto prescribed them oxycodone. Dr. Carl Anderson. Dr. Anderson had his office in Staten Island. He only saw patients in the middle of the night, prescribing opioids under cover of darkness. It was not uncommon for crowds of people to form outside his office at 3 or 4 in the morning, prompting 911 calls from his neighbors. Tragically, several of Dr. Anderson's former patients overdosed and died, including 2 of his employees. We also charge a pharmacist, Mark Klein, who ran a pharmacy in Long Island, where he filled hundreds of medically unnecessary prescriptions for large quantities of oxycodone. In exchange for filling these sham prescriptions, Klein received cash payments, free meals, and an all-expense paid trip to Atlantic City. When confronted by one of his employees about his practices, Klein was brazen. He stated, "I guess you could call us licensed drug dealers." And he added, "Oxy pays the bills around here." Cases of this type and significance require close collaboration and coordination with our law enforcement partners, and their representatives are standing up here with me. To my immediate left, I am joined today by our partner in this and so many other important narcotics case. NYPD joined the DEA in 1985 and has worked just about every kind of narcotics case imaginable, including as an undercover officer infiltrating La Cosa Nostra. I want to thank Jamie for his lifetime of service, dogged commitment to justice, and his partnership with our office. To Jamie's left is Jim Robnett, Special Agent in charge of the IRS in New York, and to his left is Commissioner O'Neill of the NYPD, and to Commissioner O'Neill's left is Frank Keelty of the New York State Police. I want to thank the prosecutors handling these cases from our office. To my right, Nick Rose, Michael Kraus, Tony Pellegrino, Stephanie Lake, and their supervisors in our office's narcotics unit, Ian McGinley and Sean Kraus. I also want to thank Mark Peters and the New York Department of Investigation for their excellent assistance on these cases. A license to practice medicine is not a grant of immunity. Doctors overprescribing opioids with prescription pads and pens are as deadly as drug dealers with prepaid phones and guns. Our office will do everything in its power to bring to justice anyone responsible for fueling this opioid epidemic that has taken so many lives. And that includes doctors who deal drugs from what they mistakenly believe to be the safety of their examination rooms. Now I would like to invite to the podium Jamie Hunt.
Thank you, Jeff. Thank you all for coming today. I really do want to thank the members of the press who have done their part in the battle against opiate abuse and misuse. It is not just because you have highlighted the work DEA does, but because by reporting our cases, you're educating the public of the dangers of drug abuse, especially opiate abuse. Last year, more Americans died of drug overdose than U.S. casualties in Iraq and Vietnam combined. 68% of drug overdoses were caused by opiates, and almost 30,000 from synthetic opiates. In the end, law enforcement is fighting a battle against drug traffickers supplying users with heroin, fentanyl, prescriptions for death by putting them in jail, and the media, community organizations, educators, and parents are fighting hard to get users in treatment and scare people from trying opiates for the first time. This conference shows how collaborative efforts can stop the flow of illegal opiates into our communities. DEA and our law enforcement partners pooled resources to shut down 6 rampant opiate sources that were feeding addiction in the Northeast. Some of these sources were so well known that they attracted drug users and dealers from all over the northeastern states who would travel to Staten Island, the Bronx, Brooklyn, and Westchester to get their fix of prescriptions. Resulting from this investigation, 5 doctors, 1 pharmacist, 1 nurse practitioner, and 3 office employees have been arrested as part of separate investigations into the same crime, illegal distribution of controlled substances. I often ask, why would medical professionals risk their careers and their lives of the patients? It is simple. They are drug dealers and are in it for the money, with no regard to public health and no regard for the medical needs of their patients. These investigations targeted bad doctors whose medical practices were significantly different than those of good doctors. For instance, Bang Bang, who is responsible for writing unnecessary prescriptions for millions of oxycodone pills, would end his workday by using a money counter in his office to tally up the cash collected from patients' visits in order to divide it between the office staff, similar to how a bank robber would divvy up the money after a score. Instead of having normal working hours, Dr. Carl Anderson held office hours starting at 2 a.m. He would close his office when normal doctors' offices would be opening to treat patients. He distributed more than 900,000 oxycodone pills working the night shift. Pharmacist Mark Klein would accept monetary tips after dispensing prescriptions or falsifying dates when submitting records to the New York State Prescription Monitoring Program. In one case, he accepted a gift of a weekend vacation to Atlantic City for him and his wife. Even after surrendering his prescribing privileges, Dr. Nadeem Syed wrote medically unnecessary prescriptions for tens of thousands of oxycodone pills in exchange for trips, cruises, and luxury gifts like high-end whiskey. Most doctors I know spend quality time with their patients to assess and address their medical needs. Dr. Nakanga spent less than 10 minutes. But write prescriptions he did, since he wrote enough to legally distribute more than 500,000 oxycodone pills. And Dr. Petro Pinto, a psychiatrist, wrote large prescriptions for oxycodone and instructed patients to go to mom-and-pop pharmacies rather than large pharmacies in order to avoid suspicion. In fact, WPIX Mary Murphy is here today, ran a story on an overdose of one of Dr. Petro patients, which was a catalyst for an investigation into the legal distribution of controlled substances, proving that press helps us in a fight against rogue opiate suppliers. This week's enforcement operation was the culmination of several cases with numerous law enforcement agencies, and I'd like to thank them all, and the U.S. Attorney's Office, Southern District of New York, for their tenacity in prosecuting cases against drug traffickers at all levels, from gang distributors to cartel leaders to drug dealers in white coats. We appreciate all that you do to help us find and prosecute those responsible for fueling the worst drug crisis the U.S. has ever seen.
Jim Robnett.
Good afternoon, everyone. My name is Jim Robnett. I'm the Special Agent in charge for the New York Field Office of IRS Criminal Investigation. Some of you may wonder why IRS is here, part of this drug investigation. Dr. Kubang Bang and his co-conspirators are charged not only with drugs, drug crimes, but also with money laundering. As alleged, greed was at the heart of the charge scheme, and they used the money that they took in hand over fist as they wrote these bogus prescriptions to pay salaries, to fund the practice, and as you've heard, to line their pockets. The dedicated agents of IRS are especially skilled at following money trails, holding accountable those who engage in money laundering and other crimes of personal greed at the expense of taxpaying citizens of New York, which we are proud to serve and protect. Criminal investigation IRS agents are dedicated and committing to uncovering, tracing, seizing these ill-gotten gains to and from their sources. There's always a trail to follow, and our special agents are committed to collecting that evidence, analyzing it, This is why you see the money laundering charges in this indictment today. The IRS is doing its part to hold those responsible, those who are profiting off the opioid crisis, and that's devastating many, many Americans. Of course, we don't do this alone, and this is why you see the group of highly skilled, dedicated law enforcement professionals behind me. Thank you.
Thank you, Jim. Now I'd like to invite to the podium Scott Lambert, Special Agent in charge of the Department of Health and Human Services, Office of Inspector General. Scott?
Thank you. Good afternoon. I would also like to begin by thanking our law enforcement partners, especially the United States Attorney's Office, Drug Enforcement Administration, Internal Revenue Service, New York City Police Department, New York State Police, and New York City Department of Investigation, to name a few, for their dedication and overall outstanding work throughout these investigations. Today's announcement underscores the role that personal greed plays in the opioid epidemic that plagues our city and our society as a whole. The defendants, including 5 physicians who violated their Hippocratic oath, callously wrote prescriptions for exorbitant amounts of oxycodone to individuals with no legitimate medical need, flooding our streets with opioids and putting lives needlessly at risk. Some of these individuals also stole millions of dollars from Medicare and Medicaid, programs intended for our most vulnerable Americans. Strong enforcement actions against healthcare providers participating in improper opioid-related prescribing and false billing practices are critical to fighting the opioid crisis. These charges should serve as a reminder to medical professionals of their responsibility to decrease and eliminate drug dependency, not perpetuate it. We will continue to work with all of our law enforcement partners in an effort to curtail the opioid abuse epidemic, protect patient quality of care, and safeguard the taxpayer dollars that go to all of our federally funded healthcare programs. Thank you.
The next person needs no introduction. Commissioner O'Neill.
Morning, everybody. I'd just like to briefly echo the remarks of my colleagues and add that the level of cooperation and partnership we at the New York City Police Department experience on a daily basis, in this case between the NYPD, the U.S. Attorney's Office, the DEA, the IRS, the U.S. Department of Health and Human Services, and DOI, has never been better, and it's never been more professional. The investigative work being conducted by the members of the DETF, the Drug Enforcement Task Force, is truly unparalleled, and it couldn't be happening at a better or a more important time. Our primary mission, of course, has always been to fight crime and keep people safe. And in this climate right now, this crisis of opioid abuse our entire nation is suffering through, we need to do everything we can at all levels of government, and not just in law enforcement, to save as many lives as possible. We need to help the people we serve from falling into a black hole of addiction and ultimately fatal overdoses. We need to help society, and we want to keep families intact. We need to all work together and to turn this epidemic around. A good step in that direction is to investigate and put away the criminals who so clearly betrayed their professional oaths, who put illegal profits above their own integrity and certainly above the well-being of their fellow man. I want to thank the NYPD's law enforcement partners who are standing up here today, and I want to thank all the other New Yorkers who know right from wrong, who alert the police when they suspect criminality. I want to thank the residents who called 911 to complain about noisy groups of pill-seeking patients lingering outside one of these physicians' offices. This is how all of us, cops, prosecutors, and all the people we serve, are sharing the responsibility for our public safety. And that's how we keep making our way forward. And I also want to thank Jamie Hunt from the DEA, who's got 2 weeks left, for your partnership and for your friendship. And good luck in your retirement, Jamie.
We'll take your questions. Yes.
I know in some of the cases, recruiters were used to bring in patients who may have been phony patients. But also Medicare and Medicaid money was used to pay for these prescriptions?
Yes, there are many instances, and those individuals are called crew chiefs, the ones who recruit. They're not real patients, they're fake patients. They get prescriptions for the oxycodone that is not medically necessary. They then sell those pills. They fill the prescriptions, they sell the pills back to the crew chief, who then sells them on the streets of New York. That is, many of the doctors charged today employed that scheme, and the pills themselves largely were paid for by Medicare and Medicaid.
Do you know how much taxpayer money was wasted?
We don't have that information. Yes.
What kind of a dent does this make? Is there any sense of there are 5 or 10 or 50 or 100 other bad doctors writing these prescriptions out there, and this is just the tiniest tip of the iceberg? Or does this make an actual dent in opioid prescriptions?
I think it makes a real dent in opioid prescriptions, because one of the doctors, Kubang Bang, was responsible for the distribution of over 6 million oxycodone pills. So those pills are no longer on the streets right now, and our office, and I know I speak for everyone here today, we're going to aggressively pursue doctors and pharmacists who prescribe this medication that's not medically necessary. Yes.
What about the manufacturers and distributors? Based on the volume, they had to know that there were certain doctors that were overprescribed. None of those companies have really been held responsible by the federal government as far as themselves. What's your position?
I can't go into any ongoing investigations by our office, but we take very seriously everyone who's in the distribution chain for these highly addictive and dangerous drugs.
Mr. Hunt, I just wanted to ask a question about how some of these doctors are elderly, and this has happened in the past since the states started cracking down on how opioids are prescribed. They started this computer tracking, and some of the older doctors don't have to do the e-prescriptions. Is that correct? And is that why addicts are going to older doctors and engaging them in these schemes?
I would say yes. There's been several doctors in their 80s who were arrested for doing the same kind of scheme, so I think the answer would be yes.
Yes.
The commissioner spoke about people that came forward to help out with this investigation. For people that think that their loved ones are being overprescribed or caught up in these schemes or just are generally aware of this, what do you want people to do, and where do you want them to come forward to?
I want them to come forward to the FBI or the NYPD and tell us about their concerns, and we will look into it, just as we looked into certain press reports, as noted the PICS 11 report on Dr. Pietro Pinto. Yes.
For most or all so-called failed patients, or were there also people who did go to these doctors with, ails and or then overprescribed?
Look, what we're charging today only relates to the patients who received these oxycodone tablets and that where they were not medically necessary. So I have no comment on any other potential aspects of the doctor's practice.
I think
Does a word leap to mind when you think about these doctors? What do you think about them in your heart of hearts when you realize that they've gone to medical school, they're bright people, and then they've just kind of given it all up?
It's horrendous. It's horrendous. As I said, these are people who have taken an oath to help their patients. They should be on the first line of defense to combat this type of opioid abuse, and instead, they're part of the problem. So I'm outraged by it. And we're going to pursue these kind of cases aggressively.
Is there any way at all to quantify how many patients you think have been wrapped up in this scheme, and with so many pills out there, even a ballpark figure for how far the reach was this in terms of getting to the population?
Well, there were millions and millions of pills that were involved in this takedown alone, and we're continuing our investigation into the area. Yes.
you mentioned that there were 2 workers that actually fatally overdosed.
Yes, Dr. Anderson had 2 employees who fatally overdosed while they were under prescriptions by him for oxycodone.
Are they men, women? Do they?
I can't go beyond what's in the charging instrument. Yes.
Is that the total number of fatal overdoses?
With respect to, not just 2, there are several. Dr. Anderson had several patients who fatally overdosed. 2 were employees in his office.
Are you able to give an exact number?
We are not. It's not in the charging instrument.
Last question.
Yes.
If I may, on another case, the New York bomb plot, can you specify how you found this guy and what these texts to someone else were about? I mean, if you can tell us who this person is?
I can't go into details in that case beyond what's in the charging instrument. Thank you very much.
Any comment on William McFarland's sentencing today?
Thank you.
Do it right now. Do it right now.
Quick statements, a couple questions on this.
The overall criminal case against Mr. Weinstein remains strong. The evidence is compelling. There are 5 remaining counts in the indictment, including predatory sexual assault. The NYPD will continue to work with the prosecution in any way it can to seek justice for these brave survivors who have displayed tremendous courage in coming forward. This time we'll take a couple questions.
Detective DiGaudio apparently heard about these prior inconsistent statements, and according to the DA's letter, did not disclose them to the DA's office. What's going on with him? Any
All right, Chief Shea is going to respond to that. Dermot?
So based on the newspaper article that actually came out about a week ago, an internal investigation was instituted regarding those allegations. That's active at this time. Beyond that, I won't comment further as to that particular investigation.
Is he still on the investigation, or has he been removed from the Weinstein case?
As we go forward right now, Detective DiGaudio has no active role in that investigation. And that's in cooperation with the Manhattan DA's office.
Graham?
Has he been modified?
No, he has not. There's an active investigation at this point.
John?
What is Detective DiGaudio accused of doing in this case?
Yeah, I won't get into any specifics. I think you saw the articles. That speaks for itself that was in the paper last week. We take these allegations seriously. Going forward, we will conduct that internal investigation, and based on the results of that, we will speak later as to what specifically the results were.
Do 1 or 2 quick more, please? Thank you very much.
Inside the outside of Force Compass.
Well, the indictment alleges that on the evening of June 22nd, 2017, when Congressman Collins received the information via an email from the CEO of Innate that he was at the congressional picnic, and that it was from that picnic that he then tried to reach his son, 6 attempts in 5 minutes, and then on the 7th attempt he got through to his son, and he it is alleged in the indictment that he illegally relayed the results of that drug test so that his son could trade on that information. And that was all done, as alleged in the indictment, at the congressional picnic.
Was he using a cell phone or did he use a White House phone?
The indictment does not specify the phone that he used, and I don't think I'm allowed under DOJ policy to go outside the 4 corners of the indictment.
Sir, the indictment says that there are a number of co-conspirators. Are any of those co-conspirators cooperating with your office at this time?
I have no comment on that.
So I just want to get a better understanding of how this decided to be investigated. Your office died. Was this a referral from the Congressional Ethics Office? Can you tell us?
I'm not going to get into how this matter was referred to our office. Yes.
The Congressman's statement said he didn't make any trades. The complaint says that he spoke with his son with the anticipation that his son would then act on the tip. How do you go about proving that anticipation was knowing? What do you need to prove knowing? What is your burden to bear here, and what evidence do you have?
Well, yeah, the indictment alleges that the congressman conveyed the illegal inside information, anticipating that his son was going to trade on that information, and I can't get into the evidence at trial right now. I can't go beyond the 4 corners of the indictment.
We're about 3 months away from a congressional election. Does your office have any concerns about releasing this indictment now and that potentially looking politically motivated?
Well, politics does not enter into our decision-making on charging a case. We bring a case when the case is ready to be brought. That being said, we are cognizant of the prudential concerns surrounding an election, but here we are months away from the election and those concerns do not apply.
Sir, can you talk about fines and jail time?
It's premature to discuss those matters.
Are there any other people currently under investigation that interested staff possibly in the current administration or formerly in the Trump administration or congressional members? Anyone else under investigation?
I have no comment on that.
How come the SEC chose to name Lauren Zarsky, Dorothy Zarsky, but this individual has not?
Well, the SEC has its investigation. It's a civil investigation they're conducting. We're conducting a criminal investigation with a different standard of proof. And so I'm not getting into the various factors that go into our decisions on whether to charge or not charge someone, but they're different investigations.
Last question.
Yes.
Has your office previously shared any of the information from this investigation with the Ethics Committee that's investigating Collins?
We have not.
Thank you.
Thank you.